Good morning.
Good morning.
Mic better?
Mic.
The mic. Switch.
Right, what you can do, what you cannot do. I'm trying to give you a concept of the whole medical practice and how you look care of your patients and what you'll be liable for if you don't take care adequately. First, you'll see, some of you think that, don't think that only the doctors are sued. Nowadays, more and more staff are sued. And it's becoming increasingly a known factor in Malaysia too. We come to definitions. What is liability? Liability means being liable or being accountable or being responsible for whatever you do. Legally, financially, it means you can be asked to pay ganti rugi here. And then, of course, disciplinary action can be taken against you by your hospital, your unit. Even if you are working in government hospitals, all three will apply for all your actions that you do, especially if you have been negligent. What is a paramedic? Is there any qualified personnel assisting in medical work? Nursing staff, lab technicians, physiotherapists, radiologists, whatever not. But actually paramedics started in the ancient Greek times when soldiers went to war. They were soldiers, and when they became old and they couldn't find enough people to join the army, those old people were asked to help in bandaging and attending the wounds. So they were the first paramedics. And later on, paramedic actually became a specialty for A&E, those who are in who service accident and emergency, those who go in ambulances. But nowadays, the word paramedic encompasses everybody. And what is patient care? Patient care is all aspects of care that you give, and this will include home nursing care. It doesn't mean that home nursing care is excluded. So you are only liable if you are negligent. And what is negligence means? First is proximity. That means those who are under your care or those who you meet. Example, suppose you are on duty, you go with the ambulance, you attend the patient. The patient is directly under your care. Anything that you do wrong, you may be held liable. But if you are off duty, you makan angin with your children, and suddenly you see an accident, and then you go and help, that you are not liable because you are acting as a good Samaritan. You are not being paid to take care. Another example is if you are on shift duty. You finish your duty, you are responsible for the patient while you are on duty. But when you go back, go home, your duty is off, you are no more responsible. The staff that takes over is responsible. But at the same time, you can be also held responsible if you have not adequately passed over vital information that happens during your duty. You have not written your notes, you have not passed over and said that this patient needs adequate care, or investigations done, not passed over. So you can be still responsible because your patient was under your care, and when you passed over, you didn't give adequate information for the next person to take care. This can happen. However small it is, it can happen, and if it can be foreseen, you are held responsible. And the harm is not trivial. Just now I said, when you set up a drip into the skin, okay, it's slightly swollen, and then you take it off, no permanent damage, you are left alone. But you have left the drip there for almost a couple of hours, the whole arm is swollen, tissues start necrosing, and the patient has to do de-sloughing and all that. That is major injury, and definitely for that you will be responsible. When a patient puts himself in the hands of a paramedic, from the time he's first seen at the A&E, your responsibility already starts. You see him at the A&E, you do a triage, and an important person has myocardial infarct, you think it's gastric pain, you just put him aside, you forget about him, you don't inform the doctor, you don't inform anybody. Then anything that happens to that patient, you are responsible. Because you have taken responsibility, you think your diagnosis is correct, you don't even tell anybody about it, you forget about it, you are definitely going to be held responsible. And this will continue from the time, a simple example is, the patient comes with injury of left side of his body, you do right side of the body, and once you do right side, everybody follows right, and then they do the surgery also on the right side. So you are the man who started the whole thing. So you must be careful what you write. And in many hospitals, what they do is, if it's right side, they label on the right hand side, they put a plaster and say, this is the injured part, so that nobody gets mistaken. All starts from A&E, all starts from admission. So if you are the paramedic staff, you must know what you are doing. Okay, we talk about standard of care. So what is the standard of care? Initially, in most countries, even now, under the Commonwealth, they use the Bolum standard. The Bolum standard is set by medical men. That means what the doctors think is okay, or anybody in your medical field, the paramedics think it's okay, the courts will say it is okay. But in some countries like Australia and Canada, they use a different standard known as Rogers and Whittaker, which now the Malaysian courts follow for the last 3 or 4 years. In Whittaker, the standard is expected by the layman. What the layman thinks or what the rakyat thinks, this is what I want. And the court will say, a court will decide whether what the patient thinks is right, not what the doctor thinks is right. Example, okay, I'll come to the example later. You must understand what Bolum is. Bolum is a test that was done in 1957. They do ECG. I think we all know what ECG is, electroconvulsive therapy. We do for people who have atherosclerosis. I mean, all of us also have sometimes atherosclerosis, but this is chronic atherosclerosis. Okay, for that they do ECG. And when they did ECG, the first photograph shows how it was done those days. The patient develops fracture of the jaw, fracture of the pelvis, fracture of his humerus, because he went into violent convulsions. So when he sued. Though Atas was Rosa, when he got injury, he got his mind in order and he said, I will sue this doctor to get some money. And then he asked, why did you sedate me when you know I can get convulsions? Why did you hold me back or put some restraints so that I didn't have so much of convulsions? And why didn't you, doctor, tell me these complications can occur? Though my Atas is not very good, I would have still said I wouldn't have wanted this electroconvulsive therapy. But the court decided, they heard all experts who came there, almost 100% said, all the doctors said, all the psychiatrists said, we don't do this, we don't do sedation, we don't do manual restraint. So the court said, okay, this is what the doctors do, fine, I accept it, and you are not guilty. In the same way, I think if there is a problem with the paramedics, they will probably ask if there's a nursing board, they will probably ask the nursing board to come, the physiotherapist, they will ask the physiotherapist, they will ask the lab technicians to come and say, okay, what this guy did, was it normal or not normal? And if not necessarily majority, even if there are out of 10 people, if even 2 people say, yes, I will do that, the court will say, okay. As long as somebody says, not necessarily to be in the majority. I hope you all understand. Understand? Okay. That was very nice. So, in the same time, all this when I put the doctor, it also means it applies for anybody doing medical work. A doctor is not guilty of negligence if he has acted in accordance with the practice accepted as proper by a responsible body of medical men skilled in that particular art. Just as I said earlier, if you are a nursing staff, your nursing board, they will be asked, your matron or somebody will come and say, okay, what this nurse did is correct, I will do it. 6 nurses say, no, I won't do it, but 4 nurses say, I will do it. Even 1 nurse say, I will do it. The court will say, okay, accepted. No argument. As long as there is somebody who will come and say, what you did is right. A doctor is not negligent if he is acting in accordance with such a practice merely because there is an opinion which takes a contrary view. That means, if 3 doctors say, I will do it, another 7 say, don't do it. Even if they said, I don't do it, as long as there is one group of doctors who are respected and they say, yes, I will do what this person did, the court will say, okay, let him go. This is very interesting. The law says, yesterday we say standard of care. So what do we say? If that nurse practices that way, if somebody comes and says, okay, that's what what I will do, then you let go free. But if you are a trainee nurse, you are being trained. If you do anything wrong, you will be judged by the standard of a fully qualified nurse. So if you are a trainee, it doesn't mean you can do anything and get away. Oh, I baru training saja, latih saja. Apa saya buat pun salah pun tak apalah, saya trainee saja. That is not valid. Because every time somebody sues you, you say, I am not trained adequately, I am just learning, so I can make mistakes. You can make mistakes while driving a car, but here you can't make mistakes while you are dealing with lives. So, even if you are a trainee nurse, you'll be judged by. So what are you supposed to do? Do what you can do, and everything ask. You will see learner drivers when driving car, they rarely make accidents. Why? Because the teacher is sitting next to them. Once they already got the license, next month, red light also zoom. Before that, 1 mile before itself, they start waving their hand, slow down, right? So this is what happens, that's human tendency. So that's why they say, you must always ask your seniors while you are training. And if I were you, I would still ask. Even if you are a first year, second year, 1 year learning, learn to ask questions. Learn something. You can only, some of us think, if I ask means, macam saya bodoh lah, tak tahu dah tujuh dia saya bodoh. But you can be bodoh once. You only ask once. If not, all your life you'll be a bodoh. And you'll make more mistakes. Nothing shy. Even after 20 years of experience, you may not know something. So you should be able to ask. Jangan bodoh-bodoh pandai and then jadi bodoh when you go to court. So as I said, be a learner driver all your life. If you don't know, even if you're a specialist, ask your registrar, because he may have learned new things that you have not learned while you were being trained. Okay, now you know what is boredom. Now I've got to tell you what Rogers was Whittaker, and then you will understand what is the difference. In Rogers versus Whittaker, Rogers is actually Mrs. Rogers. She's a lady here. One eye is almost blind. So, and then she was widowed. So she saw this doctor, and the doctor said, I can make you look a bit more prettier, you know. Now you are a widow, you are still available. I'll make you a bit more pretty. And ladies, you tell them anything, make them a bit pretty, they'll say, okay, no problem. Anything you do. So he said, I'll make your eyes a little bit better so that you look more attractive. So one eye is almost blind. The other eye is setengah blind. So he said, I will operate on this eye, close that eye that is opening like that and looking at you. You see also you run away. So he said, I'll make it smaller so that you can see more people and you will become more attractive. So this lady said, okay lah doctor, you make me more pretty, okay lah, not a problem. But there is a condition known as sympathetic ophthalmitis. When you operate on one eye, if you get infection, because the optic nerve crosses at the optic chiasma, if one gets infected, sometimes the other eye also gets infected, known as sympathetic ophthalmia. So what they did was, that eye that is blind, almost blind, when you are repairing it, the other eye also became blind. So both eyes koyak. So the doctor was sued. And what the doctor said, this is so rare, 1 in 14,000 cases. So I didn't tell the patient. If I tell the patient would not surgery. So I only said all those things that are regular things that occur. Eyes can get swollen, you might get headache, you might have drooping of the lids for a few days, pain, all these. But the sympathetic ophthalmia is so rare, I didn't tell the patient. And most doctors who came to the court said, 10 out of 10 said, I will not say, I will not tell this. So under Bolum, you are scot-free, isn't it? But what did the court say? You should inform. One eye is already blind. The other eye is tengah-tengah blind. At least you can see a little bit. If you tell her that this eye will be blind, then she will choose. At least I can see sikit-sikit. Why operate and I can lose both eyes? And he said the patient must decide. And that's what the patient... I give you another good example. Say you are a pianist. If I do a surgery on a normal person, if my finger has problems, it doesn't really matter. I got 4 other fingers, I got the other hand to use. But for a pianist, our fingers are very, very important. If you don't tell the pianist, you may lose your finger, or you may not be able to play for 6 months. At least she can play now. Pain, she can take some Tedibrax, take some Panadol and still play. But if you do surgery, if there's a possibility that she will lose her fingers, or fingers will become stiff, then it's for her to decide whether. It's not like last time. Now people are now more educated. Last time they said, oh doctor, you Tuhan, you buat apa you suka you buat, apa you suka you pun boleh buat. Now it's all changed. So the court said, all the 10 doctors came and said, I won't tell, but I think that is not reasonable. There's another case actually that happened in UK at the same time. It's known as the Dawson case, where actually the ferry goes from Dover to Calais in France. All the ferries, they'll always keep the front gates open. That's the practice all. So one day, there was some turbulence in the sea. The cars fell out. A few fellas were sitting in the car, they also fell, they all died. Then they sued. In the case, all the ferry companies came and said, we always keep the doors open. You have never closed. 30 years, 40 years we are practicing. No problem. And the court said, mana the logic? How can you keep the door open? Tengah-tengah apa ada emergency why you want to drive into the sea? Or you want to jump into the sea? Where is the logic? No logic. You can practice for 100 years the same practice, but just because one fellow follow, you just blindly follow. There's no logic in this. So they didn't follow it. So now you all understand what is the difference. For you it may be normal, but for the patient, I want to know. So you must tell what is the complication before the surgery or whatever that you do. Now we come to consent. Okay, consent, I think normally nowadays it doesn't involve, in a hospital practice it doesn't involve paramedic staff, because most of the time it's the doctor who takes the consent. Many years ago, they would always tell the staffers, ambil consent. Right? But this may be important for those of you who are working on your own, or Malaysia clinics or far in the districts where you are left all alone. So any surgery that you do, and this also includes TNS, which you all think is very simple and most of you don't do it, you have to tell. Because I remember when I was small, a dog bit me and I had 3 or 4 almost, one fellow holding my head, one fellow holding my leg, one fellow this one way, and then going on stitching. I am screaming, "Ay, sakit! Sakit ke tak sakit?" Jahit juga. Okay. So that cannot be done these days. If I say I'm above 18, if I say don't touch me, you don't touch me. So don't try to think, oh, I am a doctor, I'm a nurse, I must do this, I must save you. That all gone. You first save yourself. And of course consent, but the person must be competent. He must know what you are telling him, understand. You go and ask consent from a Down syndrome, it's not going to help you and it's not valid. Should be voluntary. No misrepresentation. Misrepresentation, the blood already got half an inch short already, then you will say, don't worry, after the surgery it will be all normal. How can half an inch become normal? So you don't tell lies to get him, entice him to do the surgery. Nowadays, if the patient comes and says, boleh mati tak? What you all will say? Celaka pagi-pagi cakap macam ini. But if he asks you, you must say yes, you can die. Government service actually, why you want, whether he does surgery, doesn't do it, you're not going to get extra money. Why you want to take the extra risk? Yes or not? You all don't say, jangan pujuk, sayang janganlah macam itu, buatlah operation, itu semua tak ada. That time all the time was gone. Now tell him frankly, you want the op, don't the op. Tanah, of course you can tell the pros and the cons. But jangan pujuk. There's no more pujo anymore. And of course, as I said, the last one is very important. If you are a hospital set up, I don't think staff nurses or anybody should be taking consent. Tell your doctor, I heard this talk and they said, I'm not eligible to take consent. You can quote me, no problem. The other thing is, silence does not mean consent, you know. You see Hindi movie, you say Malay movie, Tamil movie, yeah. They say the plus silent means, he said, oh, I went and asked her to marry me. She's very silent, that means she has agreed. You know? But that doesn't apply in medical practice. I must open and say yes or no. If you're diam, that means no action taken. No, there's no consent. So don't. And at the same time, as the patient can also refuse consent. You cannot say this is for your good, not like your parents, you know, oh, I'm doing this good for you. Nowadays parents also can't force their children. They will have to accept whether what you are saying is right or wrong. Times have changed. Those days on, just one look and everybody does what they do. Now you can whack also, they don't do what you want to do. So patients also say they can refuse. And even spouse cannot consent with you. I don't understand why when ladies go for operation, they'll go and ask the husband, can you sign? But when the husband goes for operation, they don't ask the wife also. So above 18, when you can give consent, the other party is not necessary. In Malaysia, for BTL, we ask the husband. Why? Because, not because it is legally binding, but because we do not want problems in the house. We do not want a husband and wife problem. Then go back home, the husband is just waiting for an excuse. He said, okay, you dah ikat kan? Okay, I cerai. So that is the reason why we do it. It is not mandatory, it is not compulsory, legally. The spouse patent case, I'm giving you a whole concept so you understand everything. You understand what is medical practice about rather than deciding this is salah, this is right, how you avoid problems. In this case, patent, this happened in UK. The wife, not wife, his girlfriend, pregnant. So she said, belum kahwin, I want to abort. So this guy went to court and said, that is also my baby. Kalau saya tak masuk, takkan jadi. So he says, I refuse to consent for this operation. The court said, you have no hak. Even if you are married also, you have no hak. So how can I give you your right when you are not even married? So that is not, so the court allowed her to do the abortion. Here, Risi is a case where the parent or guardian of the child who is 18 years and above came and said, do an HIV test on this boy because I think he has been exposed to AIDS. The boy said, no, you don't do the test. So the parents went to court. The court said, he's already above 18, we have no more right over the child. And then, pregnant mother. This case, the mother is pregnant and the doctor said, if you don't do a Caesar, the baby will die. And you will die. She said, nothing doing. So the husband said, no, you do the surgery. She said, don't touch me. So they went to court and tried to get a court order to get the operation done. The court said, she knows she will die. She knows the baby will die. Still she says she doesn't want. So let her do what she wants. You don't interfere. What I'm trying to stress to all of you is, if you are above 18, you can decide what you want to do. You can also refuse anything that you think is logic also. You refuse, you can refuse. And nobody can force you. Jehovah Witness. This is a case in America where this girl met with an accident. And Jehovah Witness people are Christians who believe that you should not get blood transfusion. So she carried a card which says that if I meet with an accident, if anything happens to me, don't give blood for me. But of course, when she got admitted, accident, here all bleeding, she went into hypovolemic shock. And all the doctors said, oh, we must save this lady. She's a very good Christian, very religious person. We must save. They whacked with 8 pints of blood. 8 to 10 pints of blood. Not 1 pint, 10 pints of blood. She was happy. After that, she was resuscitated. Everybody thought she will die, including the family. But then she was alive. She went back home. After that, she sued. I'm Jehovah Witness. I said don't give blood, you gave me blood. Now I have a life, but I am a sinner because I got somebody else's blood. So though they saved the life, she still sued and she still got money. Why? Because the doctors did something that she didn't want. So I hope you are getting the picture. Advance directive, this probably not in Malaysia yet. In UK, got a lot of cases where when a patient is terminally ill, she says, if I collapse, don't resuscitate me, let me go. And this B was a matron in that hospital. She was working there for 30 years. She became a matron, and she had CA. She collapsed, and the doctor said, sayang lah, this lady, I know her for so many years, how to let her go? So all of them, some nurses crying, some this one, and they saved her. So she was alive, but she sued. But she sued not because of money. She wanted to establish a principle that if I want to die, and if I don't want to be resuscitated, you don't resuscitate me. And she won the case. So this is important that you should. There's a difference. This is not euthanasia. Euthanasia is where you do something positive. I give you potassium chloride so that you die. I'm giving you something. That is wrong. But here I'm not giving you anything. I don't touch you. You want to die? Okay, die. That is different. So you must get a difference. I don't do a positive act. I'm doing an omission and let you die. When you omit, you cannot be negligent. Especially when a person has said, I don't want to be resuscitated. Okay, what do you do in an emergency situation? Yes, fine doctor, you say consent, not consent, patient competent, this, that. What do I do in an emergency situation? You can't get proper history, clinical features may not be obvious, you cannot get consent from the nearest person. Suddenly somebody is brought to hospital. What do? You may not have sufficient time. So what you are supposed to do is do what is best interest. You don't know whether it's a Johar witness, you give blood. No problem, because there is no sign. Nobody comes and says don't give blood. She never said don't do this for me, don't do that. You do what is best. You need to do amputation. Last time they will even say they need 2 doctors to sign. Now you don't even need 2 doctors. 1 doctor decides this is the best interest of the patient. You have tried to contact, you have to save his life. And in that case, the court will view things differently because there is no signs of that he is against the surgery. You want to save life, you are doing it in the best interest. This is what I always see. Oh, tablet dapat dia punya, anak tablet dapat. By the time you dapat the anak, the blood is already mampus. So you don't wait for anything. What is necessary, you do. That's a completely different picture when it comes to an emergency. And then the other thing that I think most paramedic staff are doing, some staff, I won't say most, I said some will do is, you're more important in writing the notes than attending to the patient. In fact, I have seen one case notes when it came to the court. I tengah tulis record patient susah bernafas dan telah meninggal. What will the doctor think? Or what will the judge think? That the patient is having a emergency, he cannot breathe, but I'm writing notes. That's already incriminating that you are not taking enough care. So whatever you have to do, you do first. You have to set up a drip, monitor, call the doctor, and then you write the notes. Another important thing that these questions always come up in question and answer sessions. What do I do if I call the doctor doesn't come? You will say, I got what my duty, I call him, he didn't come, itu dia punya hal. That is wrong. What you should do if the doctor doesn't come, write in your notes. I contacted so and so at this such and such a time, he didn't come. Then what do you do after that? You can't go to sleep, patient there is suffering. You call next online, husband, not available, MO, registrar, consultant. And then of course, on this side also you inform your sister on call. So that you are covered. Because you will say, sayang lah, tapi jangan kacau doktor lah, you know. And then the person who lands into trouble is you. What will the doctor say? You never called me. But why you didn't call him? Sayang, bagi dia tidur. And then finally he also won't sayang you also. So you must understand, now it's all professional. There's no more sayang, no more compassion, no more friendship at work. You do what you are supposed to do. Okay, this consent form, now things have changed. This is a bit outdated. The MMC has come out with the latest regulations. Consent is only valid for 24 hours. That means if you have taken consent in the clinic, consent form all signed, when she comes to the ward after say 1 week, you have to re-attest the form and put the new date there on the same form. I confirm all the above and sign again. So it's your job to check whether the consent form is, this is not mine or this is not UK regulations. This is MMC regulations, Ministry of Health directive. That consent, so if a patient is there, it is your job to check if the consent is more than 24 hours, you must get it re-signed again. Why patients sue? Okay, this is very important. Most of the time when patients sue, you will find that it is not because you have done something wrong. And these are studies done all over the world. 95% of the cases that patients sue is not because of your negligence. Why? Is because they're already irritated before they see you. There is delay. The patient waits for 5 hours, 6 hours to see the doctor. And then the nurses all are talking stories outside. Hey, semalam mana you pergi ya? They get so here, I'm sakit. Dia tanya mana dia pergi disease semalam. And some of you just don't care about the environment. I also got as a patient waiting for the doctor, and the other nurses are talking. Hey, hari Jumaat apa nak buat? I mean, people like they are sick, you know. So you must also be wary of your environment, what you talk. Don't be laughing and joking when the patient is sick. The patient gets very irritated. And then you are rude. I hope you know what is rude, right? Macam kurang ajar, like you're inattentive, patient telling something, duduklah, tunggulah, apalah you, bising-bising saja. You orang, you satu orang saja ke sini? I mean, all this is unwanted. That patient asks you something, buat tak tahu saja. So, all this is before he sees the doctor. So, the patient is already irritated. Just like you wait for your boyfriend is already late. Then when you call him, you cannot contact him. So we all are human beings, you know, we all get upset. So when he comes also, a romantic evening becomes so sour. Why? Because you are already frazzled already. So this same thing with the patient too. The patient is already worked up, is so irritated. And then what he said, okay lah, you buat apa salah, he definitely will catch you. So after that, if anything goes wrong, even if it's a small thing, you want to sue you. Because you sound like the patient, you bodoh, you this, you that, and he said, okay, now I teach you who is bodoh. That's human tendency. You want to? So what I'm trying to tell you is, adverse outcome, iatrogenic, lack of adequate care, incorrect care, all the mistakes, he will overlook it if you are nice to him. If you treat the patient very, very nicely, then just last week, I got this, I'm the MMA president, I got a check. They said, please give it to this doctor and to the staff of one hospital. He said, the patient died. The husband is giving this money. He says, this doctor and this nurse were so nice to me, so nice to me. But the patient died, because something went wrong. And he's giving the check for 100,000 ringgit to give to the nurse and to the doctor. Why? Because he was so nice to them. What they bought salah, actually when you look at the records, they have done something wrong. What I'm trying to tell you is, try to be nice. Try to be soft-spoken. Try to greet the patient. Then, they are willing to forgive you. They will say, okay lah, salah tak apa. You have been so nice to me. How to sue you? That day, they accept and go off. But you have been nasty to them, they will take revenge on you. So, even if there's an adverse outcome, if there was no predisposing factors, most of the time they will not sue you. And 50% of the time, it's not only the doctor who is wrong. The nursing staff have been so rude to them. No communication. Patient is there, IV drip, everything, cannot move. Catheter, IV drip. Sana pergi toilet lah. Pergilah sendiri. Macam mana dia pergilah sendiri? This has happened before my eyes also. Then they will come there, take the drip, give the drip on the hand, jalan. Surely the patient is going to get angry, isn't it? And what happens if she falls? Mampus by you. So you must see contemplate what can happen. And I'm not telling exaggerations, I'm talking about real facts. These are things that happen. Half the time we have problems with patients because we do not communicate. Communicate is talking. Communication is not just patient and doctor. Communication in all walks of life. Why do we get divorces? Husband doesn't talk to the wife. Husband comes back, reading newspaper, sleep. Girlfriend, boyfriend have breaks because not enough communication. So the same thing, why do families break up? Children don't talk to the father. Half the time you look at it, there's no communication. That is the root, not only in medical practice, is the root for all walks of life. You ask doctors, they say, dia orang tak ajar saya macam mana nak communicate. Macam mana nak communicate? Doesn't that sound silly? Nobody taught me how to come and talk in front of you. That's something that you develop. You can develop it, you have it, you must have the passion for it. So every patient that you see is just like a new love for you. You must treat that patient that way. That passion must be there. If you don't have that passion, you are going to land into trouble. Okay, which aspect is most important? Words, 7%. I'll tell you how. Tone of voice, 38%. Body language, 55%. Say, what is he talking nonsense? You must be thinking. I look at you and say, sayang. Anything? No effect. I look at you and say, sayang. It's different. I say, sayang. Which are you thrilled about? So it's the body language. So I look at you, I know whether you are interested in my talk, you are paying attention, or you like my talk, you are enjoying it or not, by just looking at you. And so can you. When you look at me, you will know whether I'm passionate about talking, whether I like to talk, or whether I'm just bara-bara saja. So you know from my body language what I'm doing to you. So that's the same thing. So your words, you can use the most flowery language. But if it is not said with passion, if it's not said with the body language, it's of no use at all. You rather not say it. Even if you say it, it's useless. So that is important. That doesn't mean you start, and people who shout, or unfortunately I have a very loud voice, you find that they are the people who land in trouble most of the time. Because some patients say cannot hear me, that doesn't mean that you need to shout. And they found that most of the time, people who land in trouble are people who raise their voice, don't communicate, and in 90% of the time, there was no problem actually, and they still sue. So it's easy, communicate, clear, connect body language. You must look at the eyes, watch the eyes, look into the eyes. Suppose I'm talking to you and I say, yeah, okay, betul. You're looking at the computer, you are reading newspaper, I don't even see you, Don't you get frustrated or not? If I come and talk to you and just look at my computer, okay. Dengar, okay, yeah. Listen, do not interrupt me, yeah. Empathize. Empathize is what? Empathize means, of course some of you don't like touching, but most of us will say, okay, when the person is crying, okay, put your hand, say, okay, that's it. I've seen doctors and they said, keluar lah, lu nak nangis pergi keluar, nangis dulu, lepas tu masuk balik. That patient already dah sakit, you suruh dia keluar lagi. Just touch her. Be careful lah, touch me, just touch, don't rub and then land into trouble. Right? Just touch, show the person that you care. Touch is a very, that's why when babies come out, we can always see when if you are working in pediatrics or working in obstetrics, you will find that when you put out your finger to the baby always grabs you. Right? That touch is important. That is a communication. And then of course you must also learn who to touch. You see young girl you touch, you see old lady don't touch, you're in trouble also. All, whether they're old, young, it's race, religion, nothing. Talk. Of course if you see they don't gana sikit, don't touch lah. Just talk. Tomorrow you don't go and say, the doctor said to touch, that's why I touch you. And that most important thing is, especially when you're a nurse, you are giving patient medicine, you're sending her back, this is what the doctor said, you must ask her, do you know or not, macam mana nak makan? You tanya dia, bukan you cakap saja. After explaining, ask whether the patient understand. You say satu sudu, she go back, the sudu that you cook one, the big one, I said that one sudu and makan. Because that she works as a cook, so for her that is sudu. So you must tell what sudu you want to use. So it's important that she understands. Village folk are not very easy. So you must understand your problems. First impression counts. As I said, maintain eye contact, welcome the patient. Normally you at eye level, same level. And of course don't talk to the patient like this. The patient gets intimidated. So you relax and see how the patient is talking to you. I see most of the doctors stand like that and talk like that as though they are some macho figure. Macho figure doesn't mean that you have to show like that. Right? You can talk nicely. So your body posture is also important. This one here is about a patient. See, when a patient comes to hospital, you all are seeing thousands of patients. For you, all of them are normal. But for a patient, when she comes to hospital, they dress up. Sometimes they even buy new dress. They want to look presentable. They put powder. I've seen patients even coming with price tag in the underwear. Price tag not removed. It shows that how new it is. So they come there to impress you. They want to impress you. For them, it's sometimes when they see the doctor, they already rehearse. I nak tanya ini, I nak tanya ini, I nak tanya ini. Semua tulis. They come there to see you. Patient has a story to tell. For them, telling the story is important. The nurse also said, they're coming to tell you a story, But I've not put the figures because I've changed this lecture to suit paramedics. According to worldwide statistics, doctors and nurses, the patient is talking, they come there all the way from, say, Masjid Tanah, they come to Melaka Hospital, they want to talk to you. They already, on the bus itself, they are thinking, I must ask this, I must ask this, I must ask this, I must ask that. They come, they will say, Sabagi doctor and all that. Within, say in a 20-minute consultation, say I'm consulting for 20 minutes, can you believe after how many seconds the doctor will interrupt the patient? Or after the nurse will interrupt the patient? Believe me, it is 9, not minutes, 9 seconds. The patient will say, Doctor, saya batuk. Okay, lagi apa? So the patient he's come, they are not like us, Some of us, you ask to talk also, we cannot talk for more than 5 minutes. So the patient has come to talk on this. Then suddenly you pusingkan dia. All the concentration is gone. Just as some of us go for exam. They want to ask, you go prepare this. He asks you something, the examiner will change the direction. Then you go up. The same thing happens in the patient. You want to come and tell you the story? Batuk, lagi apa? Lagi apa? Lagi apa? Lagi apa? Tak ada apa. You're gone. Because no story, no history, and then what has happened to you? You cannot treat, isn't it? The patient is a kapla pusing. The patient goes back home frustrated. Came all the way to talk to this burger has done this. So that's where you land into problem. And non-verbal communication is also important. Your body language, as I said, your voice, your vocabulary, human connection is very, very important. The patient is crying, at least sympathize. Okay, don't worry, everything will be okay. Nangis lah lagi, tapi keluar lah nangis. I mean, that shows that you are not caring, you are not bothered. Now, there must be you are in a medical profession, it should be a caring profession, a profession that serves. So you must set an example. Okay, I've got 5 minutes, 3 minutes, 2 minutes. Okay, I'll run through, no problem. Medical records, these are very, very important. In fact, one thing that I should acknowledge is the nurses' records are better than the doctors' records. And when you go to court, the courts will always look at the nurses' records. So you must also maintain that level. Write everything down. Right? When they want to cross-refer, they will always check the nurse's record. But if you don't write in your records, if you didn't write the doctor came to rounds, but in the notes, the doctor's notes, he has come to rounds, then you are in trouble also. So you have to write, and then passing over is very, very important. Recording the notes is very important. Don't alter your notes. Don't datang besok, ini saya dah buat lah, ini patient itu lah, ini patient ini lah, saya dah salah tulis. If you want to cancel, put a fresh paper and you write the date. Okay, this was changed on this date, and explain why you changed. If not, if it comes to court after 6-7 years, they will look at it and they say you have altered the notes. And if you write the date, then they will know that you are a very honest nurse and you have changed it because there is a requirement to change. And then, important thing is when you order investigations, this is very, very important. Half the time the investigations will come and the nurse will just put it in the file. And then nobody will see it. And then the patient dies, then you say, ayo, blood sugar was 45, man, and nobody knows about it. So if there are important things, you must write there, urgent, give it to the doctor. Before filing it in the records, I think you must show it to your doctor. No point of doing investigations if they are not reviewed. Of course, know your drugs. Thank you.